It's Dr. Kim. So let's talk about melasma. Melasma is a really common problem, and I have lots of women coming in asking me about melasma. Melasma is an acquired skin condition that presents with symmetric brown blotchiness across the face. There's a few different patterns on the face that it can come. The most common is what we call the mask of pregnancy. It happens with hormonal changes with childbirth, coming across the nose and the cheeks and often the upper lip, sparing the philtrum right in the middle. There can be a jawline pattern, a forehead pattern, a few distinct patterns that can happen with melasma, but it is symmetric, it is brown, blotchiness, generally acquired. We think that there is both a genetic component as well as an exposure component, like the hormones for pregnancy, sun exposure, etc. So it comes in three distinct forms. We have the epidermal, dermal, and mixed melasma, depending on where that pigment is sitting in your skin. Okay, so if you have a dermal component to your melasma, it's really, really important to know that before committing to a lasers or microneedling or chemical peels, because that can actually make it worse. And if you have a mixed component, that's the third type is mixed, epidermal and dermal component. So any dermal component there, putting energy into it, microneedling into it, can make it worse and make it more resistant to treatment. So we need to know that up front. How do we figure that out? Well, using my little dermatoscope here and Wood's Light. Dermatoscope and Wood's Light have distinct patterns of epidermal and dermal melasma, so you need to have both of these on your skin to properly diagnose it and come up with a treatment plan. What are the treatment plans? Well, there is topical prescriptions we can use, hydroquinone, azelaic acid. If it's epidermal, we have microneedling, we have Jasner peels. Our Clear and Brilliant laser actually does an amazing job. So we do have options, but it's important that it's diagnosed properly, the type of it is diagnosed properly, and then you go into a treatment plan that's actually going to work. Because if you have that dermal component, as I said, and someone just says, oh yeah, melasma, doesn't put a dermatoscope or a Wood's Light, both of them on your skin to determine what kind and the depth, you're going to end up making it worse, and you're going to make it much harder for me to treat for you. So that's melasma. As always, if you have any questions, make sure you post them, send me a DM, and we'll get back to you. Have a great day, Bespoke Babes.